Bray, an instructor with the ACCN program at Mount Royal University. I'm going to be talking to you today about the basics of rhythm interpretation and how you get started. So as you get started with the basics of rhythm interpretation, you have to use the foundation of the PowerPoint slides that you just viewed, knowing what each wave means and what each interval is and the regular length of those intervals. Those are the essentials that you have to know. I'm going to show you the mechanics of how to measure all of those different intervals. So I prefer to use calipers. I am going to show you how to use pen and paper, but some way that you can get a consistent measurement. So I start with my PR interval, starts at the beginning of the P wave and goes to the first deflection from the baseline, depending on the lead you were in, whether it's up or down. So I'm going to start at the beginning of the P wave, I'm going to the first upward deflection, and there is my PR interval. So the other thing I can do is I can now map that across and see if that PR interval changes. This one is nice and consistent. So I'm happy with that. Now I can measure it. So I find it simplest to take it away from the waveform itself and just put it onto a reference box using one of the solid lines and knowing that each box is 0.04 seconds. So this PR interval is 160 milliseconds or 0.16 seconds, which is within normal limits. So that's my PR interval. My QRS interval goes from the first upward deflection to the return to baseline. And bring the calipers in like that. Again, I'm going to map it across and see that that is consistent all the way through, which it is. Again, I'm going to take it down away from the waveform to a solid line to measure. And this one is about 0.10 or 100 milliseconds. Again, it's within normal limits. You can use either of the waveforms if you're not sure. Sometimes it helps to actually measure on the other one to see if that one is better and if it's the same. So my last measurement that I will do on the waveforms is the QT interval, which begins at the first upward deflection all the way to the end of the T wave where it returns to baseline. Going across, making sure that it's consistent, which it is, down to that reference line again for an easy measurement. And this one's about 400, perhaps even 420 milliseconds. So all of those are still within normal limits. The other thing I'm going to look at is regularity. So that's just going from Q wave to Q wave and going across. So this is regular. The last thing to do is to determine your rate. So there's a couple ways of doing, well, there's a number of ways of doing that. You're going to find the way that works for you. One of the things to notice and on any tracing is these are 3 seconds apiece. So this, there's 3 seconds, there's 3 seconds. That is a 6-second strip. So if I take my rate, beginning at this line, ending at this line, I can get a ballpark rate, 1, 2, 3, 4, 5, 6, about 60 to 65. So that makes me happy that I can continue on. The other way to do it is you can use reference lines. So 300, 150, 100, sorry, and I've moved that off. But you have to find your way. You've been given a number of ways in your textbooks that help you determine rate, and you use the way that works best for you. So just going to the strip below, just to demonstrate some of the differences when it's not a nice normal sinus rhythm, as this one is there's a few things that I would be looking for. One in this one that's fairly distinctive is that I cannot discern a P wave. I can see that my QRS complexes are nice and narrow, so I'm happy with where those have come from. But when I take this and look at my regularity, it is not regular. So my rate, there we go. There's 1, there's 6 seconds. 1, 2, 3, 4, 5, 6. So about 60. So the rate is okay, but it is irregular and there are no discernible P waves. So I'd be happy calling that an atrial fibrillation. Another method for measuring intervals, if you don't happen to have a set of calipers in your pocket, is very simply accomplished with a pen and a piece of paper. And you do the same thing, except now you're marking it with a pen on your piece of paper. Again, I can take that and I can determine my regularity as I just move it across. Just like I did with my calipers, and now I can take it down to a reference line and measure my intervals. So the same thing is accomplished, but very low tech, but very effective. In fact, if you want to, you could even fold up the bottom of your strip and make your little marks on there. And that's the basics of rhythm interpretation. Now you should be able to get started using the material from your textbook and the practice strips that you have. Good luck.